So we're going to start with the plumb line analysis. Now we want to line you up such that the plumb line intersects just in front of your ankle. So come in close to the line. Come in even a little. Yeah, as close as you can get without touching it. Okay. What we want is for that line to intersect just forward of the ankle. So great. And unfortunately, it is moving slightly, but there we go. That's pretty still now. Okay. And then bring this foot forward just a touch there. So they're both lined up there. Very good. And that looks like that is right, just forward of the lateral malleolus. Okay. And then from there, I want to look at where the plumb line intersects the head, the big parts, the head, rib cage, pelvis, okay? And it looks like it goes pretty much right through the center of the head. Maybe the rib cage is just a tiny bit forward of the plumb line, and then through the pelvis, it looks pretty good, right through the center of the pelvis. We're looking for big deviations there, right? And then even through the knee, it looks like it goes through the center of the knee and even the shoulder. So looks great. Another thing I would say is maybe the rib cage is just a tiny bit forward of the plumb line. Okay, and then the other thing to look at here is that the pelvis, rib cage, and head are in alignment with each other, and they are. They look pretty good. And again, we could say the rib cage is slightly forward of the pelvis, but pretty good alignment there of those three big bony masses there. Okay, and then we're going to go through the parts of the go from the side view and start with all the joints from the side view. Starting at the ankle, what I like to look at is, does the tibia look like it's vertical? Okay, and so looking just kind of from the center of the knee, coming down to just forward of the lateral malleolus, the tibia looks pretty vertical. Okay, so that looks good. Okay, moving up, and you can step forward away from the plumb line. We don't actually need the plumb line now anymore, so you can step forward. We can come out away from it. You can step forward a little bit more, so I can get in there. There we go. And then for the knee joint, I'm going to find her greater trochanter. Okay, so hers is actually pretty easy to feel. I put a flat hand in there and find that bone there. There it is right there. It's real easy to get my hand onto that. Okay, and then I'm going to go from there and come down to just forward of the ankle there, and you see there that the knee joint looks like it's a little bit behind the line there. So you can see that it looks like the knee is in just a slight bit of hyperextension. I would call that hyperextended knee there. Okay, and then moving up the body here with the pelvis and the lumbar spine and hip, I'm going to take a handful of measurements, 4 measurements. And so the first one I want to see is I'm going to get under the PSIS and ASIS. Okay, so I like to put my hands under the wings of the ilium here. Come down in here, my thumbs will be close to her PSIS, and I think I'm right on it, right near there. So I'll keep a finger there. In the front view, I like to go and get my flat hand into here and look at the ASIS. Okay, and then get onto there, and I see if I put my fingers horizontal here, they look pretty in line. This one, the PSIS is just a tiny bit above the ASIS, but close enough that I would call that neutral. And then if you want to do the triangle with the outer part of the hand, the heel of the hand onto the ASIS and the fingertips onto the PSIS, and if I look from that from the down, looking down on that, that looks pretty vertical also, so it looks pretty good there. Okay, again, so far 2 things indicating a neutral pelvic position. I'm just going to do a quick palpation of the lumbar spine. A little bit of curve there. It's a real gentle, little bit of concave curvature on the back view there. And then I'll go back and do one more quick measurement here, and that was to get back to that ASIS, PSIS. And then if we go to the trochanter here, I go up to the center of the iliac crest here. And does that look like that's above the greater trochanter? I think it is. If we look at that, those are pretty much lined up on top of each other there. So all of those measurements are pretty much congruent, saying pretty much a neutral pelvis, neutral hip, and even a neutral lumbar spine. Okay? And then moving up here, just going to palpate through the thoracic spine. So we have that little bit of concave curvature in the lumbar spine, and moving up through the thoracic spine. It looks pretty good. Yeah, nice curvature through the thoracic spine. So I even say the lower and upper thoracic spines are neutral. Okay, and then moving up there and looking at the neck there a little bit. Okay, the neck also looks like it has a nice neutral curve, just a little bit of concave curvature from the back, right? And then can you pull your hair back just a second there, Sandra?
Okay.
Yeah, very good. And then it looks like the ear is pretty much on top of the crest of the shoulder. So the acromion process is kind of, you can think of that as just the crest of the shoulder, the highest point there. And the ear looks like it's nicely lined up above that. Very good. Let's go ahead and turn around and do few of those will go up to the hip again, up to the pelvis again, from the side view. You don't need the plumb line, yeah. From this, you only really need it at the very beginning. Okay, so again, looking at the line, I like to look from a little bit of a distance back here, looking at the line of the tibia. It looks like it's coming pretty much straight down, okay? It might be tipped forward just a slight bit, but we do allow up to about a 10-degree variation there before we would call it dorsiflexed or the 10 degrees the other way, plantar flex. So I'd say you're within normal range there, okay? And then we go into the knee joint here. We again go from the greater trochanter. Go ahead and find your greater trochanter here. This is again pretty easy to find here. Good bone that you can really feel. Okay, if we go from that down to just forward up the ankle joint here, we see on this side it actually looks like it goes right through the center of the knee. So this knee on the left side, or left knee, I would call a neutral knee joint. Okay, and you can actually see from the side view, you can kind of see the difference between the two. You can see that the calf muscles, the gastrocnemius, is behind on her right side. So you can kind of see that that one's neutral, the other one's a little bit hyperextended, right? And then moving up here, going up to the pelvis and repeating our measurements there. We like to find the PSIS here. I'm going right under here. My thumbs land pretty close to. There it is. Okay, and then the ASIS, flat hand into here, right? And get onto that. And maybe a little bit higher on this side than it is on the other side, but I would still call it within reason and still call it a neutral measurement there. And if you wanted to repeat your ASIS and pubic symphysis measurement there, yeah, there you go. And again, that looks pretty vertical. And then we did the lumbar spine, which you've already felt. Again, neutral. And then our final measurement would be that distance from the PSIS. Find it again here. I think I'm on. There we go. And the ASIS, if I come to that midpoint there of those two, that looks like it is in line with the trochanter there. So again, we would say all that's neutral. So we're turn to the front view here. Look from the front. The feet, the good thing to do with the feet is to look from a distance on the feet here. Okay, so one of the things we can look at from the front view is generally, does the lateral side ankle, the lateral malleolus, line up with the lateral edge of the foot? Okay, and it looks pretty good. They actually look like that lateral side of the ankle is lined up right on top of the edge of the foot. So I would call the feet neutral here. Okay, bring the knees together, bring the legs together. Yeah, and we see that the ankles come together or the feet come together and the knees are touching, and we would call that a neutral knee. If we had a little bit of space between the knees, we would call that bowed. If the knees were together but the ankles apart, we would call that knock knee, right? Okay, moving on up here to the pelvis. Okay, we're going to look for level pelvis here. So I get onto the horizontal hands right onto the tops of the iliac crests, and we see that they are pretty level here. My hands look like they're pretty much in line with each other. And then if we get onto the ASIS bones here and look down on that, we can see that those are about the same distance from me. I can just say, look down there. It's not rotated this way or this way. It is right in that kind of coronal plane there. Okay? And then moving up to the rib cage here, if we get up and under the ribs here, and feel that ticklish, sorry. And that does look pretty level right there. Actually, the rib cage looks pretty good. So as far as level or elevation of one side of the rib cage, they look pretty good. Moving on up here, we can look for, from a distance here, look for a rotation of the rib cage. So I would look at the sternum as a good indicator here. So her sternum looks like it's pointing right at me. Okay, so it's not turned over to the either side, it's right pointing at me. And then as far as a shift of the rib cage, we would look for whether the rib cage is right directly on top of the pelvis. Okay, and I would say that it is slightly shifted to her left, just a little bit. You can actually see how her right arm sits against the side of the pelvis there, while the left arm is out away from it. You can kind of see that little bit of a shift right there, right? Yeah, and then going on up to the shoulders here, we're really from the front view looking to see if one's higher than the other. We'll do a little more precise measurement of elevation depression from the back view, but from the front view, we really just want to see is one higher than the other, okay? So we really get in here and look at these here. They actually look like they're pretty level. They look great. Yeah. And then moving on up to the head here, I would look to see, is the head rotated? Is there any tilt to the sides? And is there any shifting going on there? And so in the front view, it looks like it is pointed straight forward. There might be a slight tilt to her right. To think about that. To your right, slight tilt there. And then I don't really see any signs of a shift or anything there. Very good. Looking great. Okay, let's go ahead and turn around and do this back view here. Now from the back view, again, starting down at the feet and ankles there. And this one is a really easy one because you can just look at the line of the Achilles tendons. Okay, so what we're looking for is coming again, looking from a little distance here. And do the Achilles tendons look like they're vertical? Or do they do kind of a bell shape? The two of them come down, one, they each bow outward, or they kind of bow inward, almost like a pair of parentheses, right? And so on her, let's see, her right foot looks like it is slightly pronated. Okay, the left one looks pretty good to me. Maybe doing just a slight pronation on the right foot from the back view here. Okay, moving on up to the knee joint here. We're really looking to see, when we measure at the knee here, we're really looking for a rotation that would be at the hip joint. Okay, so if you come down here, you can feel the tissue of the muscles coming down here, and then at the bottom, the femur kind of flares outward, and we can get into the sides of the femurs there, the condyles. I like to put a flat hand onto here and feel where's the widest point on the bottom of the femur there. Okay, and then we're looking for that axis of those two to really be right in her coronal plane, and it looks pretty good. Yeah, they look right. It looks right in there. And then I'm going to say the same. You would probably guess the same thing on this side. Let's take a look here. And again, I get in there and really feel that widest point and get my fingers onto there. Again, that looks like that's right in her coronal plane. Okay, moving on up here, repeating the pelvic measurement here, going on top of the iliac crests. Okay, they look like they're pretty level. Okay, we look for a rotation here by getting onto the PSIS. And looking down on that, it looks like, again, there's no real rotations. They both look like they're right in, we could say, in her coronal plane, okay? Moving on up to the scapula here. So the first thing, look at retraction and protraction, elevation and depression, upward rotation and downward rotation, and then any kind of ways the scapula pull away from the rib cage. That would be a winging or an anterior tip, okay? So let's compare our finger widths here. So that's my 3 fingers. Hers are maybe just a little bit narrower than mine, so I'll go ahead and use mine as a good reference there. If I'm right under the edge of the spinous process and come out here to her scapula there, it's pretty good. I mean, it might be a slight bit of protraction there. We could call that a little bit protracted because my fingers, there's still a little space in between my fingers and your scapula, so yours are going to be a little narrower than mine. Okay, so on the left side, a little bit protracted, and a little less so on the right side. I would say still a little bit protracted, but a little bit less so. Okay, and then as far as elevation and depression, if you want to, I'm going to find your C7. Just tip your head forward. There's your C7. The first process below that is T1, and then the next one is T2. Hers are pretty easy to feel. Thank you. They're having nice spinous processes there. And I'm going to go to T3 in this case, and then measure to the if I follow the spine of the scapula, and again, hers is pretty visible and easy to palpate. Come up to the edge of that, and there's T3 and that at the same horizontal level, and they look like they are. And then I'm going to do the same thing on this side. Come out there to the very edge of that, to the root of the spine of the scapula. And again, looks pretty level there. Very good. So as far as elevation, depression, she looks pretty neutral there. Okay. And then let's look for upward and downward rotations. So if I find the upper corner, the superior angle of the scapula, right about there, and then the inferior angle of the scapula, right about there, and it looks like those are pretty much on top of each other in a vertical line there. And so we wouldn't call any upward or downward rotations on that side. And same thing over here, I'm going to guess. Let's see. There's that upward angle there. Pretty easy to palpate your scapula. Okay, and then again, there's her inferior angle there. And if we look at that again, pretty vertical there. We'd be looking for these lines to be this way for an upward rotation or this way for a downward rotation. They look pretty good. As far as pulling away from the rib cage, there is a little bit of winging here. There is a little bit. You can feel that. You can see that medial border of the scapula there on the left side, and again on the right side. You can see both of those. Okay, so a little bit of winging on both sides there. I wouldn't say that it pulls away any more near the inferior angle than it does all along that whole edge, so I wouldn't call it an anterior tip. I would just call it a little bit of winging. It's probably due to the protraction of the scapula a little bit. Okay, and then the humerus. Everyone always forgets the humerus. Okay, so we're looking now to see the electron process, which is really the point of the elbow, that it's pointing back and not like way out to the sides. It'll be back and maybe out a few degrees is within normal range. And hers look like they're pointing straight back. It's very good. Fantastic. And then let's go ahead and face the side here, Sandra. And then from there, go ahead and let's just watch from the side view here. Go ahead and nod your head and sequence through the spine, roll through the spine, and we're looking for any flat spots there. We're looking to see that there's even flexion. Let's drop your head down there. Great. And then we can see there a little bit of flatness in the lumbar spine. So if you look through her lumbar spine, it's fairly straight line there, and then the curvature really begins when we begin to get to the thoracic spine. And then go ahead and curl that up there, Sandra. And then one more quick check here, and that'll be from the back view to look for any imbalances between the two sides. So now let's exhale and go from the back view here, nod the head, and roll through. Great, great. And it looks pretty even there and level. I mean, when we look from back here, it looks pretty level. Maybe a little more developed on the right side than the left side, but overall, I don't see any rotations or curvatures. You actually look pretty straight here. No curvatures and no real rotations. Maybe a little more muscle development on the right side extensors there. And then you can come on back up there. Stand and up to tall. And we are